In this video, we will review the PPO plan, which is one of two healthcare plans available to University of Rochester faculty and staff members. PPO stands for Preferred Provider Organization. This means that you are able to see any provider you'd like, but the cost will be lower when visiting a provider in Tier 1 or 2. You'll notice that the deductible for the PPO plan is lower than the HSA eligible plan, and certain visits only require a copay, but that the premium or rate is higher. The PPO plan includes an embedded deductible for inpatient, outpatient, and ER visits. Your deductible is the amount of out-of-pocket expenses you must pay for health services before the plan begins to pay benefits for many covered services. Because it is an embedded deductible, a family member can meet the single deductible and move to coinsurance even if the rest of the family has not met the family deductible. Important to note, preventative services are covered at 100% even if you have not met the deductible. Here is an example of how the plan works. Dave, Stella, and Grace are in the PPO plan with family coverage and seek services from Tier 1 providers. Dave has an outpatient service and meets his $500 single deductible. He moves to the coinsurance phase and is covered at 90% for the rest of the year at Tier 1 providers. Grace goes to the ER and meets her $500 single deductible, so she will also move to coinsurance. Stella has lab work and only pays $150 towards her deductible. The $500 that Dave and Grace each paid towards their single deductibles count towards the $1,250 family deductible. Since the family has contributed a combined $1,150 towards the family deductible, Stella would only need to pay an additional $100 towards the family deductible before she moves to coinsurance. Once the deductible is met, all inpatient, outpatient, and ER services are covered at the applicable coinsurance rate. Coinsurance is the percentage of the fee that your health care plan pays for certain covered expenses once you have met your annual deductible. If you seek services from Tier 1 providers, the plan will pay 90% of the costs. If you seek services from providers who are in the Aetna or Excel's national network but are not in the Accountable Health Partners network, the plan will pay 75% of your costs. And if you seek services from providers who are out of network entirely, the plan will pay up to 60% of the reasonable and customary costs. On the PPO plan, office visits will be subject to a copay. If your primary care physician, or PCP, is in Tier 1, you will pay a $20 copay for office visits. If you seek care from a specialist in Tier 1, you will have a $35 copay. If your PCP is in Tier 2, your office copay will be $35. If you seek services from a specialist in Tier 2, you will have a $65 copay. And if you seek services from a PCP or specialist who is out of network, you will pay towards your Tier 3 deductible for office visits. It is important to note, preventative services are covered at 100% throughout the year. We encourage employees to contact Aetna or Excel's to confirm that your scheduled well visit or service will be considered preventative. Prescription coverage is included in the PPO plan. A 30-day supply of generic drugs requires a $15 copay. Preferred brand drugs and non-preferred drug are both covered per the applicable coinsurance and include a minimum and maximum range for a 30-day supply. You may also take advantage of the discounts available to you. Use home delivery services to receive a 90-day prescription for 2.5 times the cost of a 30-day prescription. Or fill your prescriptions at the URMC employee pharmacy for an additional discount. The employee pharmacy also offers courier services for employees at certain off-site locations, and employees can visit their website for additional information. The out-of-pocket maximum is the maximum you will pay for covered medical and pharmacy expenses in 1 year. So if all of your expenses combine to meet the out-of-pocket maximum, you will be covered at 100% for the rest of the year. It is important to note that the PPO plan includes an embedded out-of-pocket maximum. So like the embedded deductible, if any one member meets the individual out-of-pocket maximum before the family meets the family out-of-pocket maximum, that individual will be covered at 100% for the rest of the year. Your out-of-pocket maximum is made up of costs you pay for services covered by your health plan. These include payments towards your deductible, coinsurance, copays for office visits, and all prescription costs. An important feature of the university's healthcare plan is the Accountable Health Partners Network, AHP. AHP is a subset of the Aetna and Excellus national networks and is made up of all of the U of R doctors and a select number of community physicians. When you visit an AHP provider, you'll receive a higher level of coverage on your out-of-pocket medical costs, plus you'll have a lower deductible, copay, coinsurance, and out-of-pocket maximum. Each time you seek healthcare services, you may select the provider of your choice. You have the option to use an AHP provider, use any Aetna Excellus national network provider, or use an out-of-network provider. You may use any combination of providers, AHP, Aetna, Excellus national network, or out-of-network providers, and you do not need to choose a network when you enroll. Rather, you will make that choice throughout the year when you seek your services. Employees enrolled in the PPO plan have the option of electing to contribute to a healthcare FSA. A healthcare FSA is a pre-tax account that allows you to set aside money to reimburse yourself for qualified medical, dental, or vision expenses. If you have an FSA, you will pay out of pocket for qualified medical and dental expenses and will be reimbursed from your FSA. One of the advantages of an FSA is that you can pay for your out-of-pocket costs with pre-tax dollars. If you are considering an FSA account, be sure to view the FSA video on the Total Rewards website. If you are looking for more information, employees can use Alex, the interactive decision-making tool, to get an idea of how the plans work and a cost estimate for each plan, and check out the plan comparison chart, which details the similarities and differences between the plans. And if you still have questions, visit the Office of Total Rewards website or contact Ask UR HR at 275-8747.